Dr. Stula is back from the Life Steps Wellness Clinic, and he's here with one of his patients, Nick Stormilio. Thanks for joining us. And Nick, you're wearing the bracelet.
Donnie, you didn't want it? I got it.
And does it smell okay?
No.
No. It doesn't. But you like it
anyway.
He was right. He was dying to see the bracelet, but maybe that's just something else that will help you live longer. Gifts and smelly presents.
That's right.
Yeah, there you go. We're so glad to have you gentlemen with us today. Tell us a little bit about your background, Dr. Stula.
Well, I'm doing general medicine for many years in Milwaukee. In the last 7 years, just by accident, I think personally, very interested in a hormone problem. And of course, I started with women, and I took a lot of special interest and courses, and I took qualification test for this that's qualified me as a menopausal practitioner, thinking of I'm going to take ladies for menopause. I can tell you majority of my ladies are much younger because the hormone problem can start at any age. My youngest one is now in their 20s, a lot of 30 and 40 years old.
And doctor, we're not only talking about women. The big question of the day is, what about the guys?
That's a good question. See, the problem is with men, they don't come up that easily as women. And they don't recognize as easily their problem, or they don't want it.
Nick, what was going on with you? What was your story? What were you
Well, I always thought of myself as being in good shape, but there came a point in my life where I just started feeling more run down more often. And I felt like my stamina was leaving me. And it just, I thought maybe because I was just, getting up there in age, but.
So you were feeling tired, all the time?
I hit the gym and I couldn't get the poundage up anymore, and I just didn't have the stamina to, the high reps and the multiple sets. And
interesting that men can have hormonal imbalances too. How do you test for that?
First of all, you can do a blood test, and you find out the level of their testosterone. And then, of course, you have to do other testing to see if these men qualify for a replacement.
So did Nick qualify then?
He certainly did. Even he's talking about age. He's at an excellent age because nowadays people live longer. Mayo Clinic did the study on older people. That's what andropause comes the name, male menopause. That means the men are experiencing the same lack of hormone by aging.
Mm-hmm. Is it testosterone?
Very testosterone. That was very acceptable. Well, I'm getting old, and that's the fact of life. But Mayo Clinic did a study on men 75 and older. They were exercising, taking testosterone. Their body mass, muscular, became bigger. Even they report that sexually they were a little bit better than they used to be, and the whole outlook on life was different. They weren't depressed. Their mental attitude was good because it does affect your mental attitude to lack of testosterone.
So Nick, what was the process like for you, and what was the outcome? Was it easy?
Well, the process was pretty easy. The hardest, actually, was the easy part once I realized that I had a problem and was willing to accept it.
Because you didn't think you had a problem.
Well, I knew I had a problem, but I didn't know what type of problem it was. I just related it to either getting old or bored with certain things, being tired. Mm-hmm. It wasn't good. So I did some research, and I found Dr. Stula's website, which was very interesting, and I found that this andro replacement therapy was the symptoms were pretty similar to what I was experiencing.
So what did he prescribe for you?
Well, 3 things. We looked at a good diet, exercise, and the replacement therapy. And it's like I'm 35 again, I tell you.
It's like you're 35, watch out.
I like to think I'm running circles around the guys at the gym, guys half my age at the gym. Maybe they'd argue that, but
you feel a lot better.
Oh, yeah.
So
very much so.
With the therapy, what is it exactly? I mean, how do you get the therapy?
Well, it's probably a variety of kinds. I can tell you what therapy I'm on.
Is it in a form of pills?
No, it's a transdermal. It's a gel that you rub on in the shoulder area, under the arms.
Yeah. So how do you treat andropause?
Well, as Nick mentioned, it's not only a replacement of the testosterone. It's a whole lifestyle. that has to change. Of course, Nick had pretty good lifestyle, but it was just reinforced that this has to continue. And of course, then when we do the pre-testing, usually the level of testosterone, then we do some blood count, and then we have to actually screen people who do not qualify for this. There are two only conditions that I would consider they're totally not acceptable is cancer of the prostate gland and cancer of the breast. That's very rare in men, but if it exists, these people cannot. Practically everybody who has a low testosterone, has symptoms of lacking of this hormone, can be treated and very successfully. The younger they are, it's easier to treat. That always is the same thing with women. The sooner they recognize they have a hormonal problem, it's very easy to correct. So like Nick said, they're different. It could be gel, could be pill. They're injectables. They are more powerful. It's just the way what physician has to actually make a decision.
Dr. Nick was tired. He was saying how he was tired all the time. Are there other symptoms for people at home that you need to look out for to indicate maybe you have a problem?
It's a very good question, because people have to realize when they cannot perform anymore as they did, if they start gaining weight, they cannot lose weight, they're falling asleep in the afternoon, mentally they get a little bit depressed. That's the good expression, the grumpy old man. And their wives cannot stand them.
Well,
which
that
is
may mean a lot of men out there then.
So they could be hormones.
Poor Nick.
Okay.
And tell you, women are bringing their husbands to doctors and
They're
saying,
saying,
please
"Fix them.
take care of them.
Please, please.
I bet there's a lot of that. Nick and Dr. Stula, thank you so much for
Very
joining us
Thank
this
you for
morning.
sharing.
And for all of you out there who want to take your man in for a little hormone treatment, or if you're a guy watching and you want some help, the Life Steps Wellness Clinic, the information's on your screen.